EMDR therapy was primarily created for trauma therapy, which includes PTSD, but it's also used for depression and anxiety, phobias, self-esteem, performance enhancement, so many other things. EMDR was actually created by accident, and it's this kind of famous story, walk in the park story about Francine Shapiro, who is a psychologist. And in May of 1987, so actually 30 years ago, she was working with Vietnam veterans and sexual abuse survivors. So she was working with males and females, doing talk therapy and trauma therapy and not getting very good results. So that was on her mind, and one day she was walking through the park and thinking about something that was personally distressing to her. And as she walked, her eyes started spontaneously going kind of in a diagonal, but back and forth, left to right, left to right. And nobody knows exactly what she was thinking about that was distressing. I've always wondered, but she hasn't talked about that. So anyway, she realized she felt so much better after this walk, more than just a normal walk would provide for her. So she thought, what is going on? Could this help my clients that I feel like I'm not helping right now? So she started looking at REM sleep, or rapid eye movement sleep. And we know that in that stage of sleep, if you don't get that stage, which is the dream stage of sleep, where your eyes are moving back and forth rapidly, you probably seen somebody doing that, their eyes moving back and forth when they're sleeping. If we don't get that stage of sleep, we don't focus as well. We're not as cognitively able to do things. We are more emotional. We get more irritable. We get more sick. So there's just a lot of negative things that happen when we don't get that stage of sleep. So she started with about 70 patients over 6 months to a year, started figuring out a protocol to use this eye movement while they were processing their trauma. And she came up with what other folks have considered the main elements of trauma. Negative beliefs that occur because of the trauma, the emotions that come up, the body sensations. We know that there are cellular memories with trauma. So for example, let's say you had a car accident 10 years ago and you're talking about it, you can feel in your shoulder, oh, this is where it hurts. It's not that you're physically really feeling pain, it's that cellular memory, it's the memory of pain that comes up, and it's trauma that hasn't processed through. So that, and then also images. In its severest form, we might have flashbacks and sometimes nightmares or things like that with these images, intrusive memories that come in. So she took all of those elements of trauma and had people focus on those while she was using these eye movements, and found that she got really good results. And then fast forward 30 years later, we have over 20 very valid studies about EMDR and how well it works, and that once you get rid of that, those distressing images, thoughts, emotions, they don't come back. And that's the wonderful thing about it.